dear respected Dr. T. Ramanaji, Dr. Igor Lanzoni, Dr. Arvind Kanchi, Dr. Venu Kondul, Mrs. Sabita Kondul, Dr. Mani, Mrs. Sampurna Hegde, Ms. Netra, the other dignitaries around the globe, invited speakers, delegates, and friends. I take an immense pleasure to be part of this wonderful conference, and I'd like to thank the organizing committee for inviting me in this wonderful conference. So, I'm going to talk about prevalence of fitness, health, and lifestyle management. Little change in my title. Here is the summary: fitness and health, fitness trends, patients with heart problems, research reviews, cardiovascular benefits of physical activity, and the importance of aerobic plan programs. There are a lot of plans are there you can get on internet, but planned exercise always gives you a good results. My contribution, conclusion, and takeaway home. Physical fitness is a state of health and well-being, ability to perform aspects of various sports and daily activities without fatigue. Fitness is the quality or state of being fit. A well-rounded fitness program improves a person's in all aspects of fitness, such as aerobics, resistance training, and flexibility. Physical fitness may prevent or treat many chronic health conditions brought on by unhealthy lifestyle. Today we are facing a lot of health problems due to our inactivity. Make fitness your favorite habit, not for 1 day or 2 day or for the crash course. According to a great boxer, Muhammad Ali, I hated every minute of training, but I said, don't quit, suffer now, and live the rest of your life as a champion. How we will define the health? Health is defined by the WHO, World Health Organization, as the state of complete physical, mental, and social well being, which is marked not only by absence of disease or infirmity, according to the World Health Organization 2014. Factors for good health include such as genetics, the environment, and education. Education plays an important role, as we know, and to enhance and maintain one's health, the following measures are important: healthy diet, planned exercise, and screening of the diseases. Once a doctor diagnoses or screens, half of the problem is solved. Nowadays, the problem is if they don't diagnose the disease, then it will take a lot of time to get recover faster. So these are the fitness trends, which is important to know for all of us. Online training, it was very popular when we were in pandemic, and many students, many people, they have opt online training. Wearable technology includes fitness trackers, like how many, for example, how many steps you have completed in a day, smart health watches, heart rate monitors, and GPS tracking devices. This all, it helps in a small way for you to keep yourself healthy. You can monitor, you can just uh, find out how many steps you have done in every. Like according to ACSM, American College of Sports Medicine, they recommend 10,000 steps in a day. High intensity interval training, HIIT. It involves short bursts of activity followed by a short period of rest or recovery. Despite concerns expressed by some fitness professionals, these 30 minutes or less sessions continue to be popular form of exercise around the world. The people say always busy, always travel. So this is advisable for them to do this hit weekly. They can do 2 times, 3 times, and 30 minutes of training. Strength training with free weights. Instructors focus on teaching proper form for exercises using barbells, kettlebells, dumbbells, and medicine balls. Resistance progressively increase as correct form is accomplished. Training with free weights debuts at number 4 in 2020. So, doing exercises with free weights, it needs more dexterity. Dexterity means doing with perfection. So if you're doing in a wrong way, it will affect on your joint, not on your muscles. If your muscles develop, also it will develop in a wrong shape. So dexterity, doing with perfection is very important when you are doing with free weights. Exercise is medicine. It's a very popular word. Exercise is a medicine. It, according to American College of Sports Medicine, encourages health care providers to include physical activity assessment and associated referrals to certified fitness professionals in the community as part of every patient visit. Bodyweight training, it is old concept. Bodyweight training, we can say the old school training. Bodyweight training uses minimal equipment, making it more affordable, not limited to just push-ups and pull-ups. This trend allows people to get back to the basics with fitness. During our pandemic, with the 2 years, when the gyms are closed, so many people they are used to do with their own body weight. Like you can do push-ups, sit-ups, free squats, leg raises, scissors,
Excuse me,
cycling.
sir.
Yeah.
Sir, are you changing the slides or it's in the
Yeah, I'm
second
changing the
slide?
side because maybe this is not friendly. I will
Okay.
no, I will show you like this. It's visible now.
Yeah, no, because we just wanted to recheck whether you were in the second slide,
No,
right?
no, no.
So whether you
I'm
are
now. It's now around 10th slide now.
okay, sir.
Now you can
Fine.
see this slide now.
Yes, sir. Yes, sir. Now we can see.
Yeah, yeah. Because when I have enlarged it, it's not friendly. It's not helping us.
Okay,
So
sir. Okay.
exercise is medicine. Bodyweight training, fitness program for older adults, virtual training, personal training, outdoor activities. So these are the most fitness trends in the last academic year. So you can see health and fitness trends around the globe based on the top 5 trends from each region. So exercise for weight loss was on the top around the world, you know, and personal training, functional fitness training, fitness for older adults, training with certified professionals. These are the top in the world. Patients with heart problems, because many people they are dying early through heart problems. And if you see US 6.5 millions, according to WHO, World Health Organization 2016, 27% cases due to cardiovascular diseases and cardiovascular diseases, and globally 17.9 million. Non-communicable diseases kills 41 million people each year. I'm not threatening anybody. I'm just keeping facts in front of you. Equivalent to 71% of all deaths globally. Each year, more than 15 million people die from NCD between the ages of 30 and 69 years. Non-communicable diseases. And 77% of NCD deaths are in low and middle income countries. Cardiovascular disease accounts for most NCD deaths, or 17.9 million people annually, followed by cancer, respiratory diseases, and diabetes. Diabetes around 1.5 million. So these 4 groups of disease account for over 80% of all premature NCD deaths. Tobacco use, physical inactivity, the harmful use of alcohol, and unhealthy diets all increase the risk of dying from non-communicable diseases. So detection, screening, and treatment of NCDs, as well as a palliative care, are key components of the response to NCDs. This all reference I'm giving to you from WHO, April 2021. Which state in India has the highest heart disease? In the case of heart disease, Punjab, Tamil Nadu, Haryana have the highest rate of heart diseases. Mizoram, Arunachal Pradesh, and Meghalaya have the lowest. So we have to see their habits, the diet habits, and their physical activity. So this is directly connected with your problems. Various studies have revealed that countries like Japan, Korea, and France have the lowest heart rate related issues, and it is all because of the type of lifestyle they follow. And US has the highest obesity rate, and Japan has the lowest. So if you see the diet habits of the both the countries, you will find the difference why US has the highest rate of obesity and why Japan has the lowest. And resting heart rate, when you woke up from the bed, immediately you can check your resting heart rate at peripheral artery or carotid. You can check for 15 seconds and multiply by 4. And 72, as we know that it is the normal. If it is more than 100, you have to see the doctor, which is very important. And here I'm giving to you, you can see the targets by the American Heart Association. So at the age of 20 years, the target heart rate zone 50 to 85%, 100 to 170 beats. Average maximum heart rate 100%, 200 beats per minute. So as on, you can see 30 years, 35, 40, 45 years, it has the ranges and it should be in the same range, so not to get any side effects or any problems. Research reviews, according to Peter Cookins, the health benefits of physical activity can be realized by engaging in moderate intensity physical activity. So here the word is called moderate intensity. Moderate intensity was advisable during the pandemic situation, as well as myself now also 1 year 2 years stay in moderate activity, because nowadays many we are hearing in the news, hearing many on the WhatsApp, people are dying. When he was doing in the gym, he is dying. They are running on the outside, they are dying. So still we are finding the causes of the death, but what I feel that low to moderate intensity of exercise is okay for all of us, and don't go for high intensity exercises, so which is very very important. And for example, you're doing exercise for 1 year and suddenly stop for 1 month 2 months, and again you want to do the same type of intensity, it's not advisable. You have to go to the low intensity, stay for low intensity for 2 3 weeks 4 weeks, adopt and go to the next level. So don't do any wrong exercises or this one which will cost on your health, so which is very very important. Treatment for cardiovascular disease can differ by the type of condition. Yours may include changing part of your lifestyle like your diet, exercise, and stop alcohol and tobacco use. Medications, including ones that treat risk factors like blood pressure or cholesterol, or to break up clots. Medical procedures like having a balloon or stent placed in your blood vessels, heart valve surgery, or coronary ha- artery bypass graft surgery, according to Suzanne and et al. In the year 2019. Scientific evidence indicates that regular physical activity, exercise, and fitness are a key determinants of health, according to K. Azeem and et al. 2019. Physical activity is reasonable and strong means of prevention diseases, improvement health and well-being, according to WHO 2003. You can see all of them, they're emphasizing on exercise, diet, and your lifestyle. So these three things are very important. Keep your mind. What I'm talking to you, what I'm telling to you, I'm supporting with the reviews also the same thing what they have done before. Regular physical activity is important throughout of life cycle, childhood to old age, according to Roy Shepard 2013. Well-being is in the state of having health, happiness, and prosperity. He who takes medicine and neglects to diet, give your concentration here. He who takes medicine and neglects to diet weighs the skill of his doctors. According, this is a very famous Chinese proverb. So your diet and your exercise is very very important when you are taking any medicines. And these are the research reviews. Regular physical activity and exercise are important in reducing risk of health, death, and cardiovascular events in the primary as well as secondary prevention. A sedentary lifestyle is one of the major risk factors for cardiovascular diseases. Low education levels and low income contributed to the finding that risk factors for cardiovascular diseases in residential care centers were higher than those in the normal population in Saudi Arabia. Health authorities should develop effective public health policies for, according to Henin and et al. Recently, 2020, this was. And here you can see cardiovascular benefits of physical activity. So, according to Young Fiends, heat, and these all they are showing a positive relationship with exercises, and it's shown improvement in the HDL. So these are the values I'm giving to you. Total cholesterol less than 200 is desirable, 200 to 239 borderline high risk, 240 and over high risk. So total cholesterol should be monitored, and HDL, high density lipoprotein, it should be less than 40 mg for men, and it should be less than 50 for the women. Increase risk of heart disease if it is less than this. Greater than 60 mg, some protection against the heart disease. So people talk about LDL, but I talk about high density lipoprotein, which is very important, and how to improve it. You can take a good diet like avocados, pomegranate. This will help you to increase your HDL, which will protect against your heart disease. So LDL less than 100 mg is optimal, 100 to 129 near optimal, above optimal, and 130 to 159 borderline high, 160 to 189 is high, and very high is 190 and above. So you have to monitor your LDL. And according to American College of Sports Medicine and American Heart Association recommends for cardiovascular health. The Centers for Disease Control, American College of Sports Medicine, and American Heart Association recommend 5 days a week a moderate exercise, 3 days per week vigorous cardio respiratory aerobic exercise per week to improve fitness and reduce risk of illness and diseases. Physical activity is an any bodily movement produced by the contraction of skeletal muscles that increases energy expenditure above the basal level. And you can see from Peter Cocaines and others also. So physical activity is very very important. Most common exercise related complications. Most common exercise related complication is often associated with exercise intensity, the nature of the activity, pre-existing conditions, and musculoskeletal anomaly. So you have to see your level. Our coaches, you have to see the maturity. Training maturity is very important. He's a beginner, he's an intermediate, he's advanced, or you have to see that. And his body type also, like his ectomorph, mesomorph, endomorph, According to that, we have to give the exercise. If you are giving a wrong intensity, it will have an adverse effect, not a good effect. And you can see very clear about the range of aerobic and anaerobic heart rate zones. So aerobic zone, 50 to 60% of your heart rate maximum, very light training. And moderate, the green one, you can see aerobic activity, the zone third, 70 to 80% of your heart rate maximum, moderate training. How you will find out your heart rate? So maximum heart rate, 220 minus age times 0.6 to 0.9. So you will get the lower and the high range of limit, and you should monitor in that, so, which is scientifically proven, scientifically, you know, um, uh, advice to do exercise like this. Aerobic training session you have to do in the morning or evening. There was a lot of debate. But if you want to lose fat, you want to lose weight, you have to do it in the morning. Why? Because break fast. Why we say break fast? Because you are breaking the fast in the morning. So directly you will burn the fat because you don't have carbohydrate in the body. So you have a lot of gap, like 8 hours, 10 hours in the morning. So directly, if you go for exercise and you will get good oxygen in the morning, free from the pollution. So oxygen is very important. Do exercise in the morning if you want to lose more fat and more weight. And evening is advisable for the athletes to keep their, the high energy and all that at the 3 p.m. and 4 p.m. Usually, the athletes you will see on the grounds, they are at the same time. So find out your fat burning zone, which is very important. Fat burning zone. Oh, fat burning zone, it should be from lightweight to moderate. If you do in that range only, you will burn the fat. Carbohydrate and aerobic training, same dose. For you're taking more carbohydrate and you want to burn more fat, it's uh, like the Chinese proverb, you're doing in a wrong way. So cut down your carbs, take more balanced diet, but cut down the carbs as you can take, and take from the complex, not from the simple carbohydrates, which is very important. Protein diet or balanced diet. I prefer balanced diet, not only a protein diet. Balanced diet is very important. Crash diet and complications. People see a lot of advertisements on internet. They go for crash diets and they find some problems. So it is not the day for 1 day, 2 day, 3 day, 4 day. It's a matter of your lifestyle. Change your lifestyle, which is very important. Don't take any complications in your life. No shortcuts, only smart work. Work hard. Like people say, take the machine, keep it here, you will lose 5 kg, 10 kg. Never happen, because we are here, in this profession from more than 25 years. Our students do a lot of exercises like 500 sit-ups. They work hard for 1 hour, 1.5 hour, but they cannot get the good abs within 6 months or 1 year. So it's, we never find any shortcuts. So don't believe the shortcuts. Only hard work, which is very important, and through hard work only you can improve your health. And here I'm giving to you the walking program. You can see anybody, any age, any gender, you can start without any, because lot of my students, they have done with their families, and I get a very fascinating, gorgeous, we got uh, feedback from them. So just start with week one with 20 minutes, and second week you can take the picture of this one and you can start your exercise. Don't say tomorrow. Tomorrow never comes in our life. Lazy people say tomorrow. So don't do that. Just start from today. Go for a walk. Enjoy yourself, keep music or anything which you like, just walk. You should have one pair of good shoes and see that the shoes is not, you know, lost this one. It should be, the sole should be straight, which is very important. And you can walk every day to improve your health. Then walk jog program. Here you will walk for 5 minutes and 1 minute you will jog. This is the second model. Little bit this is challenging, more challenging than the first one. So, and this is not advisable for them who are more than 75 or 80 kgs and their age is more than 40. You have to walk. The first slide, uh, you can do this maybe 5 cycles, unless you are now ready for the higher activity. So then you can go for the second model. Then we have the third model, walk, jog, run. So 5 minutes you will walk, 1 minute you will jog, 30 seconds you will run. In the first week, in the last week, you can see 1 minute walk, 1 minute jog, 1 minute run. Fascinating results, which students like 19, 20, 21, they can start this program. They will get a facility. If you just work out this 2 years, 3 years, and just go for the second one and continue this, you will keep yourself healthy. You will not get any problems like diabetes or cardiovascular problems. Keep your heart strong. If your heart is strong, your total body is strong. If your heart is weak, your total body is weak. Full body workouts. And here I'm giving to you some advices from American Heart Association. They are suggesting 30 minutes of exercise every day for 5 days, 25 minutes of exercise for 3 days. The intensity will be little bit high. High intensity only 2 days they can do if you don't have time. But presently, for this 1 year, 2 year, 2 years, don't do any exercise because we don't know. Many people are complaining lot of problems due to high intensity training, or they are sudden deaths we are seeing in the gyms and outside. So please don't do any high intensity exercise. If you have diabetes or high blood pressure or any type of problem, non-communicable disease, don't do any high intensity exercise. Do you have to go for only low to moderate exercise. Pomegranate is very good. It's good for the heart. Every day, now it's summer, you can take one every day, which is has very good benefits. You can go on study about it, about pomegranate. It has lot of benefits for heart. Pomegranate juice is the running as the most heart healthy juice. It appears to protect the heart and arteries. Small studies have shown that juice improves blood flow and keeps the arteries from becoming stiff and thick. So you can control your blood pressure through this pomegranate. Don't stop, take pomegranate. It's very good for your heart and your circulatory system. So take this one because juice contains antioxidants like blueberries, red berries. These are all antioxidants. Green tea, you can take this one to keep yourself healthy. And you can see lot of exercises. You can do physical activity at home, or if you have a one pair of dumbbell and bench, you can do all these exercises at home. This was we were having a program in our university. I was given this suggestion in my university. We have started weight control exercises for morbid obese. They are all more than 40 BMI. So we have given them every semester. Half knowledge is more dangerous than ignorance. So take all the information from standard one, like American Heart Association, American College of Sports Medicine. There are a number of articles out there, but from where we have to authority, see the authority where and take the suggestion from there. This is my contribution. Impact of aerobic and anaerobic cross training on coronary heart disease and biometabolism was a major project I've done in my university. It was successfully completed and it was published in uh, ISI journal. And this was also major project. Impact of three different types of training on body composition, blood pressure, anthropometric circumference, and selected fitness varies among overweight males. So this was also successfully completed and was published in ISI journal. Effect of resistant training on selected physical and physiological variables on the male students was recently it was completed and was published in Web of Science journal. And impact of physical activity on body composition, flexibility, and muscular endurance on males. It was uh, presented in the Pre-Olympic Congress at Liverpool, England, and was published in the proceedings of the Pre-Olympic Congress. Influence of combined strength come aerobic training on health and selected fitness variables among overweight males. It was presented in the International Congress in St. Petersburg, Russia, and it was published in the proceedings. Full paper. Effect of 12 weeks brisk walking on blood pressure, body mass index, and anthropometric circumference of obese males. It was presented in France and was published in the World Academy of Science, Engineering, and Technology. This was my recent publication in Web of Science, a single author paper. It was done on morbid obese. Morbid obese is more than 40, 40 BMI, body mass index. So it was published in Medical Science as a single author paper. And this was my single author Web of Science in Q2 journal recently in Romania. And this was also published in Switzerland in Q2 Web of Science journal. And this was also my part of project. And recently, last year, it was published in Web of Science journal. November 2022 Q2 journal in Romania. The conclusion is here: cardiovascular disease are the major causes of mortality and morbidity in developed countries, and their prevalence is increasing in developing countries. Atherosclerosis is the major causes of cardiovascular disease. It has a long clinical history and may be well progressed before symptoms occur. Inactivity and low fitness are the strong risk factors for cardiovascular diseases. Both confront increase in risk similar to associated with smoking, hypertension, and high blood cholesterol. Being physically active or fit may reduce the risk of having a stroke. Mechanisms by which physical activity may modify cardiovascular risk include effects on lipoprotein, metabolism, blood pressure, and endothelial function. Physical activity is a central component of cardiac rehabilitation. Exercise training may enhance myocardial perfusion and hence oxygen delivery to the heart. Exercise reduces symptoms of claudication and heart failure and may help to lower blood pressure in hypertensive individuals. And here are my recommendation. Take away home. Exercise is a medicine. So don't skip from exercise. Start from today. Don't say
Excuse me,
tomorrow.
sir.
Yeah, this is my last slide.
Yes, yeah. Yeah,
Engage
sure,
in
sir.
regular physical activity and well-being. Health checkup every year. If you're more than 40 years, 50 years, you have any problems, check up every year, because prevention is better than cure. Improve the knowledge like exercise, nutrition, and health. Take balanced diet and maintain in and out of your calories. If you want to lose weight, you have to, for example, if your body weight is 100 kgs, 100 kgs multiplied by 24, 2400 calories. If you want to lose weight, 2400 calories minus 500, it is 1900 calories. So you have to take 1900 calories if you want to lose the weight. Fight and reverse the type 2 diabetes, exercise, diet, and natural medicine. People, if they know that they are diabetes, they think they will die. No, you have to fight. Diabetes is nothing but it is a friend. How you respond to it, how you, and it will respond to you same in the same way. So you have to change your lifestyle, do exercise, and change your diet which is not friendly, the foods which is not friendly for diabetes. Stop that diet and change your diet with it, which is friendly and help you to reverse the diabetes. Improve your cardiovascular health and follow systematic aerobic program. Take warm water early morning and after the meals. This is a Japanese technique, and that's why they are having the lowest uh, obesity rate in the world. Prefer 4 different color of fruits and vegetables in a day. This is recommended by the International Nutrition, that you have to take 4 fruits in a day. Take minimum 8 glasses of water in a day, not at the same time, but divide it morning, afternoon, evening, until they take every 2 hours, 1 hour. Take. Don't be dehydrated, but take water. If it is summer, you need more, drink more. So thank you for giving me an opportunity to attend this wonderful conference. Thank you very much, and over to the organizer.